Chapter 22, the heart and circulation 1, shortness of breath. Shortness of breath or breathlessness is dysphonia. At first, this is caused by exertion, physical activity such as climbing stairs, but in severe cases, it may be present even at rest. A patient who is breathless when lying flat orthopedic, for example, in bed, will tend to sleep right up on 2 or more pillows. The abbreviation SOBOE stands for shortness of breath on exercise or on exertion or on effort. Patients say, I get terrible short of breath climbing stairs. Doctor can ask, how many pillows do you sleep on? Heart rate. The normal resting heart rate is 65 to 75 beats per minute. In athletes, it may be as low as 40 beats per minute. In extreme athletic activity, the heart rate can go as high as 200 beats. The heart rate may be regular or irregular, and an irregular rate arrhythmia. There may be early beats which interrupt the regular rate, premature beats, or the rate may vary with respiration, or it may be completely irregular, as in fibrillation, when patients are aware of irregularity, they describe the symptoms as palpitations. Case 4. A 22-year-old student was admitted to hospital with a long history to heart problem. She had been increasingly tired with shortness of breath on exertion, orthopnea, and palpitations. A mitral valve replacement had been carried out 3 years previously, and this had stabilized the symptoms of heart failure, but was followed by episodes, attacks of atrial fibrillation, which had been particularly severe for the 6 months before admission. Heart failure occurs when the heart is unable to maintain sufficient cardiac output, the amount of blood pumped by the heart each minute. But the body's needs, it may involve the left side of the heart, the right side, or both. In left heart failure, the main symptom is breathlessness. The symptoms of right heart failure include peripheral odem swelling beginning in the feet and ankles. This is known as beating edema. When a finger is pushed into the swelling, it causes a small depression or pit. Aorta, pulmonary artery, pulmonary veins, mitral valve, septum, tricuspid valve. Chapter 23, the heart and circulation 2. Physical examination. Medical examination is normally carried out in 4 stages. Inspection, looking, palpation, feeling with the hands, percussion, tapping with a finger, and auscultation. Listening with a stethoscope. The verb is palpate. The noun is palpation. Not palpation, examining the heart and circulation. Here is an strand for a textbook describing of how to examine the cardiovascular vascular system. Look at the lips, tongue, nails for the blue discoloration of diagnosis of cyanosis may be central. Fever, inspect the hands for clubbing, feel the radial pulse and the worst, and note the rate, for example, 70 minutes. And bright, regular or irregular. The pulse may be regular in force as well as time. Check that the other peripheral pulses are present. Ensure that blood pressure enhances the jugular venous pressure, JVP. JVP. Palpate the chest for the apex beat, the normal position if the fifth left intercostal space 1 centimeter medial to the myclavicular line. Feel for any thrills. Heart size may be measured by percussion, listening for murmurs, and other abnormal sounds. For example, friction drops beginning at the mitral area. Murmurs may be soft or loud. A harsh murmur is loud and loud. Note the time of any murmur in relation to the cardiac cycle. The most common murmurs are systolic and systolic in the middle of the systole, and systolic lasting for the whole of systole. LD, diastolic, diastolic, late diastolic, presystolic. Continue by listening at the tricuspid, aortic, and pulmonary areas. Chapter 24, Infections, Fever. Medical student has made some language notes on a case report. Case 45, a 24-year-old man presented with a fever which he had for 3 days. On the third day, he had a severe attack of fever with Sweden and records. The only past history of relevant was hepatitis 4 years earlier and glandular fever infection with Epstein-Barr virus. At the age of 18 years, he had returned from Africa 3 weeks previously. Microorganisms. Infections differ from other diseases in a number of aspects. Most importantly, they are caused by living microorganisms, such as viruses or bacteria that can usually be identified, thus establishing the etiology in the illness. Many of these organisms, including all bacteria, are sensitive to antibiotics, and most infections are potentially curable, unlike many non-infections, degenerative and chronic diseases. Communicability is other factor which differentiates infections from non-infectious diseases. Transmission of pathogenic organisms to other people directly or indirectly may lead to an outbreak or epidemic. Finally, many infections are preventable by hygienic measures, by vaccines, especially life-attenuated vaccines such as rubella vaccine, or by drug prophylaxis, for example, chloroquine to prevent malaria. Microorganisms include bacteria, viruses, fungi, protozoa, such as the parasite that causes malaria. Another general word for these pathogens is microbes. Patients often refer to microbes as germs or bugs. Notice the common expression for acquiring an infection disease. Could he have cough pick up some disease from the dog? I think I've coughed the flu bug that's going brown. Source and spread of infection. Here is an extract from a medical textbook. Infection may originate from the patient endogenous, usually from skin, or from outside sources, exogenous. Often another person who may be either suffering from an infection or carrying pathogenic microorganisms. Carriers are usually healthy and may harbor the organisms in the throat. For example, diphtheria, bowel, salmonella, or blood, hepatitis B, or HIV. Non-human source of infection include water, milk, food, animals, birds, and also the soil. The incubation period is the period between the invasion of the tissues by pathogens and the appearance of clinical features of infection. The period of infectivity is the time that the patient is infectious to others.